Hi, it's Dr. Tucker, and today I want to give a little more context to different problems with the disc, the spinal disc displacement. There's a lot of misunderstandings about how a disc can just kind of slip into place, out of place. Somebody comes in with what they think is a slip disc, they can just slip it right back in. But hopefully this will help. There's generally 4 progressions that might clarify this. So you can start with a more of a symmetrical displacement called a disc bulge. This is where you have at least, I think, about 25% displacement over the bone, the vertebral body, where it's kind of a symmetrical stretch. Some people refer to it kind of like a saggy tire that like leaks and stretches out. And that can cause inflammation and pain, obviously, as well as the ones that progress further. Now, a disc herniation is where there's more of a tearing or a hole or leak through, well, not quite fully through, but breaking through into partially the outer fibers. And those hard fibers, right, those annular fibers are designed to kind of keep that jelly material in place. If it starts to rip through, that's called a herniation, right? It starts to push through those fibers. So typically it's going to be a little more towards the back and side, right or left, or both. And that can obviously cause pain and inflammation as well. Typically it can distend a little further than a bulge. Now, if it actually starts to completely break through those annular fibers, the fibers that hold it in, they'll call that a disc extrusion. Okay. Now, a disc extrusion has punctured through the annular fibers. But if that material now that punctured through those fibers completely rips off what they call the parent disc, now you're looking at more of a sequestration, right? So if it's sequestered out, that just means that it's completely detached. And this little guy can start to migrate and cause problems elsewhere as well. So think of those 4 phases. There's other categories, but in general, it's not just a matter of slipping in and out when it wants. Okay.